have a graphic here that shows the symptoms of heat exhaustion, and these are some that we should really take notice of, whether it's ourselves or a parent. Talk to us a little bit about these, Dr. Mendoza.
Right, so the first thing you'll see is you get, a little bit of dizziness, maybe some nausea. I don't feel so good, I kind of feel like throwing up a little bit. Those are the things you want to listen to your athlete or your child for, okay? Certainly by the time you get to the point where you have any kind of headaches, you need to stop. And your activity, rehydrate, and get them in a cool place. Sometimes what you'll see is the athlete come in after the activity. Hey, I've done a whole hour, 2 hours of practice, and they come and have a really bad headache. Okay. Well, did they fall? Did they have a head injury? A lot of times it's just dehydration.
Wow.
You want to make sure that you're getting them seen if you're concerned, if they have severe headaches, but make sure you're hydrating them. Muscle pain, of course, unconsciousness is a late sign, and that's something. If your child has decreased activity, is lethargic, is not acting right. Moms know best.
Moms know best.
When a parent brings a child to the Baptist Pediatric Emergency Room, and the mom says, "My kid ain't right. My kid is just not acting right," I believe them 100% of the time, because I've seen them for 30 seconds, and the mom's known them for a lifetime.
Right.
So if your child does not act right, is not acting well, is too tired, pay attention, get them hydrated, get them to a medical professional.
As a parent, I'm thinking unconsciousness, and it gives me a little bit of anxiety.
Yeah.
So what are some things to look out for when you say your mom knows you, obviously, but you said I can tell in an instant?
Yeah, parents always live in a little bit of anxiety, right?
Yes.
We're always worried about kids.
Yes, I know that planet well.
So we kind of live on that edge a little bit. So, there are certain things that kids do normally, developmentally normally, whether it's a 2-month-old, a 2-year-old, or a 12-year-old. The physician who's seeing your child, the pediatrician, a pediatric ER physician who sees your child will know what the developmental milestones are, what's appropriate for a kid. If a kid's sitting up in a bed in the ER and you brought them in because they're a little dizzy, a little weak, and they're alert and they're talking, you kind of understand. The minute they're confused, maybe not as active as you expect them to be, maybe not having eye contact, those are all warning signs. Okay. But we're talking about late signs here. Now, before that, you should see muscle cramps at home, dizziness, feeling of nauseousness, headache. Those are all reasons to stop, get hydrated, go see somebody, go see your pediatrician, or go to the nearest pediatric emergency room.